Okay, we'll go ahead and get started. Hi, everyone. Thank you so much for joining us here today. My name is Paige, and I am the vertical marketing manager over the veterinary vertical here at Weave, and I'm really excited to be here today. We're going to be talking about 5 innovative solutions to the veterinary staffing shortage, which is something all of you guys might be dealing with right now. We know a lot of you guys are very busy and dealing with more and more demanding clients. So we've got a great presenter here with us today to help give you some ideas about how to support your practice amidst kind of these issues. I'm thrilled to introduce Steve Dale, who is a certified animal behavioral consultant and travels the world speaking at veterinary and animal welfare conferences. He is a host of 4 radio shows, both WGN Radio in Chicago and syndicated, and has appeared on TV everywhere from The Oprah Winfrey Show to Good Morning America. He's authored and contributed to veterinary books and books for pet parents. Really quickly, just any questions that you have, feel free to submit them in the regular chat box, or you might see a little section of Q&A. You're welcome to click there and submit questions as well. And we'll leave some time at the end to ask, and Steve will answer any of the questions you may have. So now I will pass the time over to Steve, and it's all yours.
Thank you so much, Paige. So you're the vertical marketing manager. Is there a horizontal marketing?
No, we have one of me for each of the verticals we service. So dental, opto, and I get to be over vet, which is super exciting.
It is super exciting, I think. And, we're at a very interesting time now. And some might have said, well, I could have predicted this will happen. And I'll explain all that. Is there really an industry shortage of veterinary professionals? What about clients who seek to get appointments? And in many places around America, from where I live in Chicago, so urban areas, to certainly out in more rural areas, appointments are really, really hard to get. I don't have to tell you all this, or I might, because it may not be impacting your practice. But if not, it probably will, and I'll explain all that. So first off, yes, indeed, there are more pets ever in America than ever before. So here's the data. I'm going to go through some of these slides are busy. I apologize for that, but it's like, which data do I put up here? Which data don't I? So 85 million people, or most households in America, have at least one pet. Pet ownership has increased 20% since 1998. A lot of households have cats, even more have dogs, although people with a cat generally don't have a cat. They have, I think it's 2.3 cats. People with a dog, I believe it's 1.7 dogs, therefore actually more cats than dogs by most who count this stuff. Millennials, they're the ones, I mean, look at that number. Nearly 90% of homeowning millennials have at least one pet. A quarter plus of all pet parents are millennials. 32% are Generation X. 78% of pet owners, 78%, that's a lot, acquired that pet during, or at least one of their pets, during the pandemic. And nearly everyone who has a companion animal says that companion animal is a member of the family. In fact, that bond is more intense than ever before. So raise your hand if you've been practicing veterinary medicine as a technician or as a veterinarian. By the way, if there are any technicians watching, thank you for all you do. I do this in person. It's much easier in person because I actually ask for applause for veterinary technicians, because without technicians/nurses, the profession would not be what it is. And the problems I'm about to describe would be tenfold or 50-fold what they are. So thank you, the underpaid, under-recognized technicians and nurses in veterinary medicine. All right, so the bond is more intense. And the reason why I said, if you've been practicing 10 years or more, I would see a show of hands saying, yeah, I've noticed that for the most part. And there's data to support that, which we see in front of us right here. I'm not going to read through all the data, but in fact, Pet parents today are looking for veterinary professionals to talk about the human-animal bond, to understand the human-animal bond, and to understand the emotional well-being of their companion animals. If that cat is even scruffed, let alone what kind of some practices still do, but hopefully not. Take out the fishing net and drag the cat from the floor because you've thrown him out of the carrier. If a client today witnesses that, that client may no longer be a client because the emotional well-being of companion animals matters more than ever before. So that's the client side. How about the veterinary side? Again, due to time constraints, I'm going to give this talk live at a couple of fetch conferences and elsewhere. I'll have much more time to talk about more. So this is a truncated version, if you will, but you'll get the idea. A 2018 national study of veterinarians reported 2018, before the pandemic, that at that point, veterinary professionals said, hey, we're overworked. And in fact, as a result of that, there was a 6% shortage just for that explanation alone. Even before the pandemic, a 33% increase in demand for pet healthcare was projected. A total, and that's before the number of pets we have today. A total of over 22,000, almost 23,000 additional veterinarians, 23,000 veterinarians, not to even include the techs, will be needed by 2030 to fill the void. Now, add to that, 13% of companion animal veterinarians are over 65, another 26% between 56 and 65. So by 2030, a lot of those guys will be retired. Another 18,000 plus more companion animal veterinarians will be needed by 2030 to accommodate anticipated retirements alone. That's not to mention people dropping out of the field for other reasons. That's nearly 41,000 needed by 2030 to fill the void. Now, new graduates are going to continue to come in, of course. So that's about 26,000 people, but still there's a gap. And that gap is significant and in fact may grow. By 2030, the number of dogs and cats in the US is expected to increase substantially to 20 million, potentially. That's a lot of dogs and cats. Currently, there are 72.9 million children in the US. So we have far more pets than children in America. Of course, I say pet parents, right? And pet parents say fur babies. So they do consider increasingly their pets their children. So, excuse me, here's an overview. More companion animals than ever before. The numbers continue to rise. Fewer veterinarians and technicians who continue to be underutilized, which I'll talk about later. Millennials and Zoomers, Generation Z, I'm told you're called Zoomers, are demanding answers now, right? I mean, we've all experienced that. We've seen that. Maybe you're a part of that in another way. The food service, right? The food hasn't come in 5 minutes. Where is it? I want it now. That's kind of the American culture more and more. More intense human-animal bond than ever before with, as I talked about, and I cannot stress this enough, people really passionately caring more than ever before about the emotional well-being of their companion animals. Fear-free and cat-friendly practices plays into all that because they came about, they're wonderful, and they came about at just the right time when the emotional well-being mattered more. And more people are aware of fear-free and cat-friendly, and they want you to be that. And they don't necessarily, although increasingly, as both of those initiatives market to the public, they may actually look for the logo, but they expect what that logo represents. They expect fear-free handling, and they expect a cat-friendly environment. Cats are finally seeing the veterinarians. So for years, people like me waving the banner, as I still do, saying, okay, here's how to get your cat into a carrier. Here's how to get that drive to the veterinarian and all that stuff, right? Well, finally, people are paying attention, not because people like me are saying it, but because millennials care about cats more than we've ever seen before. So that's a good thing, but not if that cat parent says, okay, I'm willing to get heartworm prevention for my cat. which we've been screaming about for years, right? And then they can't see you. Cats are increasingly educated. Cat parents are increasingly educated about what their cats need. We see now more minorities, first of all, have pets than ever before and understand the messages. I mean, because someone doesn't necessarily have resources, of course, doesn't mean they care any less about their companion animal. And now, slowly, veterinary clinics in some places in America are popping up in what were previously deserts. But if they're not able to be staffed, you're kind of right back where you started, right? Public health implications of people not seeing the veterinarian are significant. I mean, theoretically, if I'm making up a number and I'm making this all up, but it's possible that in my crystal ball, and I've got one, 10% of pet parents, again, making up that number, won't be able to get a rabies vaccine for their dog because they can't see a veterinarian because they can't get in, or the rabies vaccine is so overdue. Rabies in America? I mean, there are public health implications here. Even with increased pressure, veterinary professionals continue, though, to feel overworked and underappreciated by clients. They're dropping out of the profession. So you've got that happening at the same time, everything else I've talked about. Pet parents and the public then potentially developing animosity, even anger, toward the beloved profession of veterinary medicine. And there are animal welfare concerns with animals not seeing a veterinarian, of course. So there are many long-term and mid-term ideas that are out there. This slide does not represent all of them. I don't even know all of them. I don't pretend to. These solutions will help maybe by 2040 or 50. Maybe some by 2030. But they're not going to help you tomorrow. And they're good ideas. And everything, or some are. So creating a PA position in veterinary medicine, good idea or not, I don't know. I'm not going to talk about that here. It might be. Attracting young people into the profession. That's a great idea by being proactive about going into schools in all sorts of neighborhoods in America, in urban areas, and getting people even more excited about veterinary medicine. They're 8 years old, they're 10 years old. So if they go to school to become a veterinarian, that's not going to help tomorrow. How do we get the loans lower? I have no idea. People are working on that who have ideas. That's not going to happen tomorrow either. So these ideas are great ideas, and there are many more of them, but they're not going to make a dent or much of a dent in the profession in the next couple of years. So what can you do to help? And I'm not saying I have all the answers, but I have 5 ideas. Now, these ideas may not be perfect for you, but what they might do is spark other ideas, like saying, okay, this is what I can do given my practice. Virtual care. Somewhat controversial in some places. It should not be, first of all. Well, there's 2 buckets for this. First of all, the one that should not be controversial and should be what, and isn't, and should be what everybody does tomorrow. And this is what your clients actually want. So concerning follow-up for things like behavior or pain management, other topics as well, virtual medicine with existing clients, with an existing relationship with that client, does all sorts of things. First of all, it frees you up, if you're the veterinarian, to do other things. It gives technicians, and I'll talk more about this again, but here's a spot for it right now. It gives technicians something to do that is appropriate for them to do, that they are qualified, or ought to be, if they're certified or licensed technicians, to do. And that is to be on this side of the computer screen, look at that home, maybe, or using a telephone, and FaceTime or something, and saying, oh my gosh, you do have 3 litter boxes, but they're all together. And that is kind of like one giant litter box. So here, spread them out throughout your house. Tell me about your house. And here's how we can do it. Or following up for pain, which I talk about all the time. So hooray, hooray for Silencia, right? That's coming in. It's here. It's about here, depending on where you are in the country, right? So it is pretty much here. How do you follow up with people? Is it working? Well, probably there's no staircase in your clinic. Probably no matter how cat friendly you are, you still cannot see that cat act like the cat would act at home. And it's not only Silencia, it's probably a multimodal approach. So are they doing these other things right? Are they using the Assisi loop correctly? Whatever the case might be. You can see all that, and this should be something that is easily done. And as I will also talk about later, your clients want this. Millennials they prefer to do this. And they're busy. Everybody's busy. You're busy, but everybody's busy. I've got to drive the kids to soccer practice. I've got to go do this on my second side hustle. I've got to do this and this and this. I may not have time to come in, but I have time to do this. And there should be a charge for sure for this, meaning a virtual visit. Now, how about the more controversial part of this? Even the less controversial people aren't doing. You can do this. But it's a way to see clients that are already clients. I feel so passionately about this, as you can probably tell. But the second bucket is the one that's more controversial. Because of various states, most states, veterinary practice acts, the clients may not have a relationship with that veterinary professional, with these third parties that provide virtual care. Now, I am only supporting those and suggesting those that have veterinarians with a license to practice and veterinary technicians and nurses answering the questions. But that's most of these, if not all of these. Why can't we do this? Forget about the Veterinary Practice Act. I'm not a lawyer, so I'm not telling you what to do legally or not. But we need to. I would argue that some care, especially from a professional, is far better than no care. And they can't get in to see you anyway. Why not? What is the downside of this? Now, some say, oh, it's going to take clients away from me. There's no data to demonstrate that I'm aware of. In fact, in Canada, where it's routine to have some virtual care like this, I believe, from what I understand, the data is reverse. It demonstrates actually the clients are driven the practices. So I can help you right now with your pet that's limping, but you still need to get radiographs next week. So you can't get in right now. I can give you some tips about what to do. Behavior, for sure. Two dogs aren't getting along with one another. I can give you some tips to keep those dogs safe. It doesn't mean you don't need to see either a veterinary professional, such as a veterinary behaviorist, or perhaps even someone who does what I do, either a certified dog trainer. That's not me necessarily. I am, or a certified behavior consultant, which I am. You get the idea of what I'm saying, I hope. Millennials, Generation Z, they're comfortable with this stuff. And there's data to demonstrate this. By the way, I have proceedings on all of this stuff. Steve at stevedale.tv. And I'll show it at the very end slide too. If you want me to send you those, I'm more than happy to. The alternative is that people desperate to get answers for their babies, their pets, will go to Dr. Google. They will go to friends, neighbors, relatives, the dude in the dog park, whoever. Those answers might be right, but they probably may not be. And we support veterinary medicine, right? So isn't it better to have a veterinary professional answer the questions? And I suggest the answer is yes. So supporting a company, not financially, but just giving the option to clients who cannot come in to go to one of these providers, I personally view as a good idea. And it's going to happen. It's got to happen. So be there right now. Texting, that's actually the preferred way to communicate, to make appointments, to confirm appointments, to offer information to clients about anything. Okay, my pet's come in for a dental. That's our dog right there. She's cute. She came in for the dental. My wife gets that image of her and says, oh my gosh, she seems okay. I think she seems okay. What we also know is that your clients prefer this method of communication, but we also know it can save. Now think about it. You make a dentist appointment. My gosh, yesterday or the day before, actually, I got a haircut. I got 2 texts before my haircut saying, do you want to confirm the appointment? It's a way, first of all, more people are going to show up who you expect to show up. So you don't get people just not showing up. They will cancel, which frees up those slots for other clients, which is good for your practice for obvious reasons, including that you don't make people angry because then you call them back and say, oh, I have an opening. It's also a way to free up your time. So you're not calling, you're not having your staff call these people. When they do, they get voicemail. So it lowers the number of phone calls. Phone calls aren't going to go away. I'll talk about that next, but it minimizes the number of calls. Text to meet in the parking lot or at the door. We don't need the pandemic for that. The average text is 13 seconds. The average call is about 90 seconds. You'd save 176 hours a year at least. Missed calls, that's 30% of missed revenue right there. You can communicate faster by texting. I mean, this is stuff at this point most of you know because most of you probably prefer texting yourselves. Why don't we do this for our practices? As I said, it reduces phone tag. According to a Pulse survey from Weave, 2 in 5 Gen Zers believe their veterinarian is outdated. How does that feel? The survey suggests 34% of Generation Z also want to see similar technology to that used routinely for their own human health, and I would argue your own human health as well. So why can't the veterinary industry do it? Now, you're not responsible for the entire industry, but you are responsible maybe for what you can do in your practice. And this seems to be a no-brainer for me. Phone calls, they're not going to go away. When a patient calls in, though, isn't it better not to say, hold on, we care about you? How does that feel? You call the airlines, your cable company, and you hear that recording. We care about you greatly. Hold on for 20 days. And you're, sitting there. No one likes that. Your clients don't either. First off, they prefer texting when possible. It's not always possible to communicate everything that way, of course. So now if you're texting, maybe you even need less staff to deal with the phones. I don't know. But I do know this, fewer phone calls. When they come in, wouldn't it be great to see who's calling and to know everything about that person? Weave happens to do that. And there are other systems out there too, perhaps, that do that as well. But it's like your phone. You know who's calling, but unlike your phone, you can also say, by the way, you need heartworm prevented. It's been 4 years. You can also say happy birthday to Fido. You can also say, because everything is personalized and it's right in front of you, including information on not only Fido's birthday, but medications, medical treatments, vaccines needed as well. It's right there. So many practices still have the paper files, and someone has to go back and find a piece of paper that says whatever it is. It's right there. And not only does that save time, makes clients feel better, by the way. There's no question about that. I mean, if someone says, hold on one moment, please, as opposed to, hi, Dorothy, I understand you are due for heartworm. I mean, huge difference. Huge difference in the way your clients feel. And how your clients feel that way on the phone is what really they feel about you. And there's lots of science to demonstrate that how they feel is what's most important. Not only how their pets feel, but how they feel. And how they feel about you begins with that first interaction. That's what I'm trying to say. Full use of licensed, registered, and certified veterinary technicians and nurses. We're not there yet. Nowhere near. Nowhere near. We have the staff that is so qualified. So it would free veterinarians to do more about what some of you actually prefer to do. It allows technicians and nurses to do more about what they prefer to do and what they are trained to do. Now, I can give a whole talk on that, perhaps with a technician, but I don't have the time to go into detail. It's been spoken about before. We know retention is higher. We know that examples of new jobs, virtual care, I just talked about that. So if you didn't do virtual care, now you can, and you have technicians and nurses right there who can do it. You can offer puppy classes, kitten classes. Yes, even with this mess going on right now, you can expand your services by allowing technicians and nurses to do what they are trained to do in the first place. Many clients prefer to bond with technicians. No offense. Some veterinarians are intimidating just because they have the DR in front of their name to some clients. Also, technicians and nurses, I think, are the best communicators in veterinary medicine in the first place. During the pandemic, the mantra was wait in the car. Well, maybe that's not a bad idea for some practices in some places. So I'm talking to a company based in Utah. I understand they just had a snowstorm, so maybe not a good idea at this very moment. So it depends on the circumstance. New York City, what parking lot? Where do you wait? If it's in Manhattan, right? But for many places around the country, the advantage of that is faster turnover, no dog fights in the waiting room. It is a cat-friendly way to do things, and maybe there's a separate entrance for people with cat carriers in the first place. No arguments in front of other clients, should there be one. And why not go to where the pet is? If the pet just needs the dog a leptospirosis vaccine, and that's it, and there's no history of adverse response or anything like that, why not just go to the car, have the technician do that, give the vaccine, boom, boom, you're done. And by paying, by the way, and I haven't talked about this, and we've helped provide this as well, by paying via Apple Pay or any of these online services, Venmo or whatever, or even directly through a charge card through your system, rather than some of the antiquated systems. You go to a grocery store, you could just tap. So why not have these better pay systems? So the vaccine could be done in the parking lot, and pay could be done any number of different ways. Only reason why I hesitate, it could be any number of different ways, and the client just does it that way. Again, millennials prefer that anyway. So you're actually pleasing clients and you're saving time. And if people pay right there, there's no need to follow up to pay people to get people to pay, right? That doesn't happen as often. So these are just some ideas. Again, here's my website, but my email is steve@stevedale.tv. If indeed you want proceedings for this, here's how to find me in social media, including our kitten Groucho, who has his own TikTok page. Here are some of the books I've contributed to. I've ended actually 1 minute early. So if you have any questions, I am more than happy to try to answer those. As I say, I'll be at a couple of Fetch conferences doing a longer version of this talk. And my hope is other conferences as well.
Thank you so much, Steve. That was awesome. We have some people in the chat saying thank you, and these are really good practical ideas. One question that we got that I was kind of wondering myself is, I know a lot of practices deal with demanding clients on the phone who might be super difficult to communicate with, or they're just difficult. And sometimes that can take up a lot of time for your staff. And what would you recommend to kind of help shorten those phone calls or deal with those demanding clients when they're calling in and they want help right now?
And there's more of that than ever before. And part of the reason why there's more of that than ever before, I'd say that's 3 reasons. One is because you have a lot of angry people who are accustomed to the veterinary profession. So if I had called my veterinarian, excuse me, for a wellness exam for my dog, or I just adopted a cat, I want to see the veterinarian, which is the right thing to do. And now you have more people who we've trained and are finally doing that right thing, right? So they call and they can't get in. Now you can, and lots of other places in the world, from restaurants to everything else, you can make appointments online. Um, if they tried to get in and they can't get in and they think something is wrong with their pet, or in some cases they just want a wellness exam, you have angry clients. So everything I talked about might free up more space for more clients. So fewer angry clients from that bucket. But there's two other buckets. One is the nasty people who have always been nasty. And the second, which are not most clients. I would argue people who have pets are always loving, kind, adorable people. The second is our society has changed. And millennials and those from Generation Z in particular, but everybody, I want it yesterday, not now, yesterday. And they get frustrated or angry if they don't. So how do you deal with those people that, for whatever the reason, are really, really difficult to deal with? Well, it depends on what they're asking for and how reasonable the request is. So that makes it a very difficult question to answer. If they're being absolutely unreasonable and have a history of that, I see nothing wrong with firing those people. But you know what? Even to do that, you have to be very careful now, because they're going to go online instantly, potentially, and talk about how awful you are. So even that, for the most rotten clients in the world, the angriest people on the planet, even that is challenging to do. So what I suggest is say, hold on, please, after offering anything you can, everything you can, as long as the wait time isn't too long, and say, let's talk to a practice manager here, and have the practice manager handle the call. Now, that doesn't answer everything you asked, but it really depends on what they're asking. So, for example, there was one real life circumstance where I talked to someone, and they all they needed was a tech appointment, but the person on the phone didn't understand. There was a misunderstanding. So the person thought, I have to come in and see the veterinarian. The person on the phone thought, okay, but we can't do that for another 8 days, whatever it was. Didn't realize that the vaccine, whatever vaccine it was, I don't recall, just required, I think it was also lepto, a tech appointment. That's all. And that was easier to come by. So sometimes it's just a matter of communication.
That's
I hope
great.
I answered, even though it's...
No, that's helpful. I think this is something that veterinarians and practice owners and practice managers deal with on a daily basis.
Absolutely.
And it's
And
just
you
kind of
know,
part of the
there are people that give talks, hour-long talks on that very topic regarding communication, which is just a slice of what I'm talking about here. But
totally.
I hope I helped in some way.
Yeah, I think so. And I think someone just said it best in the chat. They said communication is crucial. Thank you for that, Jose. I think that's very true. So something to keep in mind. And Steve, I loved that you said this is a small percentage of hopefully the clients we work with. And I think that's so true. I think it's easy to get caught up in the negativity of the few people, but kind of keeping a broad view of like...
Here, I've got it on my desk. I'm not going to tell you the name of the conference, but this is true. I've got to fold it over. I spoke at this conference 3 or 4 years ago. I'm not sure when. Just now, they sent me, and most conferences don't do this, but some do. And if you don't know this, speakers do, you grade the speaker. And happily, I got all outstandings on this one, excellence mostly, and one good. But I'll tell you, if I had gotten a pour on any of these, even though it was 4 years ago, why do they send this to me now? But even though it was 4 years ago or something, I would still feel upset. It's that one person. And it's human nature for people who care. And I don't know anyone in the veterinary profession that doesn't care. And for those who don't, we talk about animals being relinquished to shelters, and the explanation for that is ultimately the bond fractures. Well, when the bond fractures with the profession, with you and the profession, maybe that's when it's not right anymore, in all honesty. But for most people, overwhelmingly, and every person who goes into the profession, I've not met anyone who has gone into the profession for any other reason than to say, I want to help animals. And the intent is clear. So I don't even know what started me on that path in the first place. I'm sorry.
No, you're great. I think this has turned into an awesome conversation. And I think what you shared today was super helpful for a lot of people. And I think it's something a lot of people are dealing with right now. So we're super grateful for you, Steve. Thank you.
Well, you're welcome. Thank you.
Thank you.
No more questions?
No more questions.
No
and
more.
For anyone who is on the line, we have recorded this webinar and you will get it sent to you via email, and it'll be available on our website. So if there's anyone in your office or colleagues or anyone that you want to share this with, please feel free. And if you're interested in Weave, some of those texting features and things that Steve talked about, feel free to click that request more info button at the top of the screen. We are offering a $105 Target gift card this month for seeing a demo. So no commitment there or anything, but if you're interested in learning more about Weave. Thank you so much, Steve.
Sounds good. Thank you, everyone. Have a happy holiday and a happy new year. And I appreciate you taking the time to watch.
Thank you, everyone. Have a great day.